Yeah, and it was really desperation. They were willing to try anything and take any precaution because it was all just such a mystery until the Europeans, Dr. Koch, actually discovered, what this little tiny organism was, Mycobacterium tuberculosis, that they were finally starting to use a scientific approach and to attack it. And that to me was really one of the most interesting aspects of the book, how medical science developed, and it almost developed because of tuberculosis. They were that was the great killer, and that's why medical science, that's what they were trying to find a cure for. And so much of the research was around, tuberculosis.
Hello, I'm Derek Cash with the North Little Rock Public Library System and want to welcome you to Meet the Author. Joining us today is historian and author, Professor Larry Floyd from Oklahoma State University, Oklahoma City, to discuss the book, Stalking the Great Killer, Arkansas's Long War on Tuberculosis, co-written by Dr. Joseph Bates, Associate Dean and Professor of Epidemiology at the University of Arkansas for Medical Sciences. Thank you for joining us today.
Glad to be here. Thank you.
All right. First question I want to ask is, because the book is co-written, I wanted to ask, how did you and Dr. Bates meet? And how did the two of you collaborate on this work?
Dr. Bates had a first cousin named Jim Wallace who lived in near Oklahoma City, where I live. And I've worked with his wife, Pat Becker Wallace, who does children's books. And I'd done some more serious work besides children's books, and I had a history background. And Jim kept talking about his cousin, Joe Bates, Dr. Joe Bates in Arkansas, and some of the great things that he had done as far as fighting tuberculosis, especially back in the 60s and 70s when Joe was instrumental in helping to close the tuberculosis sanatorium. Basically, it became obsolete. And Jim kept talking about this, and he moved back to Little Rock, where he lives now, about 5 or 6 years ago, and started talking with Dr. Bates and said, I've got a guy that he's done some ghost writing and done some books of his own, and I'd like for him to work with you and put this story down. Well, Joe resisted it for some time. He said, "Oh, it looks like I'm kind of blowing my horn, and there's a lot of people that were involved, and not just me." And he just resisted for several years, and Jim stayed after him and wore him down. And so finally, Joe agreed to meet me, and so I came over to Little Rock, and we sat down, had a good discussion, and the one thing that Joe said, "I don't want a book about me. I want a book about Arkansas's fight against tuberculosis and maybe my small role in that fight." Well, he had much more than a small role in the fight, of course, being one who knew Joe Bates. And it's just a real tragedy that he's no longer with us. About the same time the book actually went into print and became available, he came down with a very fast case of colon cancer, inoperable, and succumbed within 5 or 6 months. And so I think he had one book signing, mostly among his colleagues at the health department, where he had worked as a consultant and as sort of a special scientist for many years. I never actually worked full time for the health department, I don't believe, but he worked a lot with many of the people there. And so that was he got one book signing just about 6 weeks, I think, before he died last fall. And so we had great plans on marketing this book, and of course he's the driving force because he's the expert on all this, and it just didn't happen. It was just kind of tragic the way it ended. But the book has been well received, and Joe knew that before he died. Many of his colleagues congratulated him, and so that was, sort of a last hurrah for Dr. Joe Bates.
Well, I got to admit, the book, even though it's about tuberculosis, I really enjoyed reading it because you don't have to be a doctor and you don't have to be a scientist to appreciate what you've written and to understand what you've written. So yeah, if Dr. Bates would have written it, he might have written it more from a medical standpoint, although there is a lot of history. So I think the two of you, of course, having never met him, I think the two of you balance each other, that you wrote it from a historical standpoint and he could put a lot of the medical aspects and what he did and what he knew in this state, so that it's a very easy read and something that I think anyone that's interested in the topic would find enjoyable. So I want to commend both of you for doing a great job.
Well, thank you. And I think you did sort of hit upon it. I, as a historian and a journalist, and that's really kind of what I've done both as a journalist and a historian for many years, I'm kind of accomplished at synthesizing and putting together narratives. I'm certainly not a medical expert at all, but I can look at the past and sort of see the story and sort of put that down. And so that was the collaboration. And so Joe was the technical expert. He knew what was important and what needed brought out in this story. And so he would guide me. Then I would do a little research and come up with the next chapter or two, and then we'd sit down and hash it out, and he would mention the salient points that need to be brought out. And so that's how we worked together. It worked really well, I thought.
Well, having said that, then I'll try not, if I ask you a question that because he did this part and you didn't, you just might not be able to answer it. And we'll understand that, especially if it's something that borders on a lot of medical expertise that, as a historian, you just might not know the answer. So I'll keep that in mind.
Please do.
Okay. One of the things I noticed about this book is that I once read, it was about Tolstoy, of War and Peace. And when he was living, that there was a lot, if you study Russian history, in the 1860s and 1870s, syphilis and gonorrhea were prevalent in Russia. And if you study the Russian periodicals of that period, there were all these quack remedies for those diseases. And I noticed that you bring this up in your book, not necessarily quack, but people thought if you do this, it will help cure you of tuberculosis. Share some of those, if you can remember them. Share some of those solutions that were not really medically correct, but that people thought if you just do this, it will help cure you of tuberculosis.
Yeah, I thought that was an interesting aspect of the book. I enjoyed the research of some of that, and quackery is a good word for it. I think it really speaks to the desperation, though, of the public. You'd said earlier about in Russia with syphilis. Medical science, if you really think about it, it's really new. It's in the last 120 years that we've really made the strides that we take for granted today. So people were desperate. In tuberculosis, the one that really emphasizes that desperation was when they were in New England, actually digging up their dead relatives who had died of this strange disease that usually affected their lungs, that seemed to somehow spread among family members and sometimes in the community. And so they were digging up, there was actual fears of the walking dead. And because people and families, one of the family members would die, and then 2 years later, lo and behold, one of the other family members gets sick with this same disease. In their minds, well, how would that happen? Maybe the previously deceased relative was actually arising from the grave and infecting family members in nightly visits. And so they actually were a lot of cases actually, and several of them that were actually made some magazines and newspapers of people digging up dead relatives and pulverizing their bodies and burning their bones. That was really one of the stranger aspects. Now, on a lighter side, the low-cut bodice for women, and especially I saw several cases in Arkansas where some newspaper editorialists were warning women about wearing the low-cut dresses that revealed their bosoms and how that could lead to tuberculosis. But again, it was really desperation. They were willing to try anything and take any precaution because it was all just such a mystery until the Europeans, Dr. Koch, actually discovered, what this little tiny organism was, Mycobacterium tuberculosis, that they were finally starting to use a scientific approach and to attack it. And that to me was really one of the most interesting aspects of the book, how medical science developed, and it almost developed because of tuberculosis. They were that was the great killer, and that's why medical science, that's what they were trying to find a cure for. And so much of the research was around, tuberculosis. The germ theory sort of developed about the same time. And it was kind of a chicken and the egg. Which came first, the need to cure tuberculosis or the theory itself? They kind of developed at the same time. And the germ theory, it's only about 124 years old, to be honest. Well, it was a theory before that, but it's really only been the last 125 years that 100% of the doctors actually accept germ theory. As late as 1900, some doctors, and I think I used a couple in the newspaper articles in Arkansas, some of the doctors were still sort of guffawing at the idea that there was a tiny organism that could actually kill people. So,
yes, you bring up Robert Koch, and I felt so sorry because I didn't know about the history. I mean, I knew very little about the history of tuberculosis, but I felt so sorry for him in the sense that he was so desperate to find a cure for the disease, and he did come along with some very important issues. And because I'd heard of him and knew who he was, I'm just so glad it was just one of the few characters in the book that I knew about and I could relate to a little bit. I'm so glad that you discussed him. But like I say, I felt so sorry for him.
yeah, and he and Pasteur both, they were almost side by side. Pasteur was sort of the father of the germ theory. There were other people involved, but he kind of gets the credit. But they were actually looking for a vaccine too, that elusive vaccine, and they're still looking for it today. That never happened. They sort of gave up on the vaccine. That was Pasteur more, I think, looking for the vaccine. And so they started looking for a cure since they can't prevent it. And then, yeah, so there was a lot of failures of both the vaccine and the cure for many, many decades before the 1940s and 1950s. And those were sensational breakthroughs when you think about all the effort and the desperation that went into trying to find a vaccine or a cure for tuberculosis, to actually find some of those early drugs. Streptomycin, of course, was the very first that did have an effect on it. It didn't turn out to be by itself the ultimate cure, but used in conjunction with other drugs, that was sort of the beginning of the end of the really desperate years of tuberculosis.
Because this is a history of tuberculosis in Arkansas, how effective was, taking the whole period that you cover in your book, how effective would you say was Arkansas in eradicating and treating TB? I mean, there were great strides, but at times it seems like there were intense political struggles. Discuss that a little bit.
Well, Arkansas actually, started sort of behind the nation. Arkansas was one of the worst hit, as many of the other southern states. And there was a number of reasons for that. Some of it had to do with the climate itself, some of the pockets of poverty in southern states like Arkansas. A lot of people living in congested areas and households in particular. The lack of regular treatment by doctors, that sort of thing. So Arkansas started behind, but through the efforts of men like Dr. Bates and Paul Reagan, who was his colleague. Paul Reagan was the head of the TB division at the Department of Health. Arkansas eventually, by the 1980s and 90s, became a leader. And by the by the turn of the century into the 2000s, Arkansas was actually on the other side of the equation when it came to cases per 100,000 per capita in Arkansas. So Arkansas became a leader. And a lot of that had to do with those early community-based programs that Dr. Bates and Dr. Reagan really pioneered. That was kind of the key part of the book as far as Dr. Bates, how he and Paul Reagan saw in the 1960s that these sanatoriums and the old way of treating tuberculosis were outmoded, that with the drug therapies, that it would be possible to treat people in their communities. There'd be no good reason to send someone off for a year or two to a state sanatorium like the one out in Boonville, which caused a lot of financial hardship, often ended up with broken families and marriages. And so the idea of a community-based treatment program was sort of revolutionary. Now, there were other people that were experimenting in other areas that were kind of onto the same thing, but Dr. Bates and Dr. Reagan, put it into action in the 1960s. And of course, they met lots of resistance. There was kind of some economic and political interest in maintaining that sanatorium. And that was really kind of the fun part of the book for me, talking with Dr. Bates, because he remembered those years and how he was speaking publicly, going to lots of meetings and basically saying that, we're headed down the wrong way if we keep this outmoded sanatorium and don't develop these community-based programs where people can be treated in a general hospital. And of course, they did actually pioneer that whole program in a number of, with Pineville, is that the town? Yeah, Pineville, south of Arkansas. Yeah, that was the first pioneer program down there. And then they got 4 other hospitals throughout the state, expanded that program, and that really changed everything by the 1970s. And that really is what doomed the sanatorium in Boonville.
Because you do bring up sanitarium, and I think that, I don't know, maybe because I'm of a certain age, but when I think of tuberculosis, I always think of that's where you go. You go to a sanitarium, and you bring it up in the book. I want you to explain to the audience, what was life like for the patient in a sanitarium?
Well, it was very much like it would be very much like being an inmate in a state prison, especially in the early years, maybe even worse. That was in the 20s, 30s, 40s, and 50s, the heyday of the sanatorium outside Boonville. When a patient first entered those sanatoriums, they were confined to their rooms, often were told not to leave their bed, confined to their beds and their rooms for at least the first year. And they told them not to go outside, not to get fresh air, not to exercise. A lot of the things that they later said, gee, the very things that will help this patient, we're denying them. And so the first year was extremely confining among a lot of patients that were dying. If you were lucky and the disease went into remission, you would graduate to another area where you would be among people that were starting to get better. So even before the drug treatments, before the drug therapies, people would get better depending on their genetics, depending on how well they took care of themselves. And so some people were actually released, not a great deal, not a great percentage of them, but some would actually get better and get released. But they would usually recidivate and come back years later. And that was the story of people that had sanatorium before the drug therapies. They would get better if they were lucky. They'd go back into their community. A few years later, they would relapse, go back to the sanatorium. And then eventually, most of them would succumb to the disease. It was interesting to me, some of the prominent names in the state history that I brought out in the book that died. Governors, judges, Judge Hill, Joseph Hill, who was very instrumental in opening up the state sanatorium in Boonville, at a very early age came down with tuberculosis, had to quit, had to give up his seat at the Supreme Court, state Supreme Court, and spent the rest of his life, sort of fighting tuberculosis. Now, he lived to a ripe old age, but eventually he ended up in the sanatorium that he started and dying there around 1950. One of the buildings, the Nyberg building, that was one of the more prominent buildings at the sanatorium, was named after a state legislature, a representative named Nyberg. I can't remember his first name at this point, but he died not long after he was able to get some funding to get the sanatorium up to the state where it was in the 1950s, and then he ends up going there and dying just a few months later. So just a lot of tragedies, a lot of good people that died from this terrible disease that they just didn't have a good handle on until those drug therapies, those miracles of the 1950s.
It seems to me when I was reading your book, when I think of Mayor W.R. Dooley and his wife, they had tuberculosis, but it was kept quiet. It made me think of AIDS back in the 1980s and even today, where it was like the disease was something, if you had it, you tried to keep it as quiet and secret as possible. Not necessarily that there was a shame, but you knew that if your neighbors and family and friends found out, your life was radically changed. And so was there that impression back then that if you got this disease, I mean, it was just almost like, don't touch them, don't get anywhere near them sort of thing, like you would have with HIV today?
Well, exactly. By the 1910s, 1920s, they were making the connection of it that this disease, it just wasn't spontaneous, that you actually could people that were down with the disease could actually transmit it to the people around them. So once that connection was made, then yeah, if you had tuberculosis, you were to be feared, and rightfully so. I mean, you could transmit that disease. It was not transmitted as easily as a lot of people thought, because there were actually cases of husband and wife where one of them, they'd lived together their whole life, one of them would die of the disease and one would not. It was really kind of unpredictable from that standpoint. Some of that might have been genetics. But yeah, by the 1920s, 30s, and 30s especially, that's when the sanatorium started isolating people. Yeah, if you came down with it, then you were a pariah. People were afraid to be around you, and you were doomed. And in most cases, and so it was a terrible thing. Some people actually, there was one case in the book where Dr. Bates, as a young doctor, I saw a woman at an emergency room. I think it was at one of the hospitals there in Little Rock, and he told her she had tuberculosis, and they were going to set up a treatment program. And he found out the next day or two that she'd killed herself. She went home and killed herself. And so it was a shame, and many people just thought, that's it, my life's over. And in many cases, that was it. Their life was over.
Another theme along those same lines that I noticed the way you write and the emphasis you put is there was like almost I don't know what the word is, fighting among the medical personnel as well as maybe the people in the state, which was more important, education or treatment. And it just seems like you can't really it's like the cart before the horse, or the chicken and the egg. You've almost got to have both. If you tell people like no spitting, or maybe sleep in separate rooms, sanitation, that sort of thing, versus at the same point, treatment, you can help with the eradication of this disease. Do you understand the point I'm trying to make?
Yeah, they went hand in hand.
Yeah.
Education, the treatment, one didn't work without the other, especially before the drug therapies. Yeah. When they were trying to isolate the ones who had it, and that, the rise of public health in the early part of the 1900s, that was really because of tuberculosis. There really wasn't a public health effort, as far as cleaning up some of the poorer parts of towns, and personal hygiene. That was all emphasized under the guise of public health. And that was really part of the tuberculosis push. Um, they realized that there were a lot of things that went into tuberculosis, and personal hygiene, um, cleaning up, areas that were unsanitary. Anything that would weaken the body would allow tuberculosis to creep in. They didn't quite understand it that way, but that's really what that public health effort was all about, keeping the community and individuals as healthy as possible to resist tuberculosis. That saved a lot of lives before the drug therapies. But really, before the drug therapies, it was a forlorn hope. It was difficult, very, very difficult. That's why that was really almost miraculous. Uh, those early drugs, after so many, many hundreds of years of people dying from tuberculosis in heaps. It's funny, just today I was reading an article in the Wall Street Journal, and they were talking about some of the efforts in different diseases, and it said, but still the big two right now, malaria and tuberculosis, around the world, killing more people than anything. And so the great killer is still the great killer.
What is the status of TB in Arkansas today?
Oh, almost non-existent. Arkansas has done so well, as most of the United States and much of the developed world. Most of the TB, when we talk about the great killer, it's in underdeveloped countries, not in the developed world. And Arkansas is actually better than most of the states right now. I remember Dr. Bates said there was a little flurry of tuberculosis in I want to say around 2005, 2010. There was some Pacific Islanders that were coming to Arkansas to work in the poultry industry. And so again, they were from a less developed part of the world. Many of them were carrying tuberculosis. It was sort of in a latent state. A lot of people in the less developed parts of the world are actually carrying tuberculosis. Maybe half the population in some of those areas. They don't all come down with the disease, but they have the potential. And so that brought some fears to the community. And of course, Dr. Bates was all over that. He recognized it immediately, and so they took the steps to contain that. I think he said only within a few years they had that under control.
Okay, all right, very good. Professor Floyd, if people want to buy this book or if they want to contact you, how can they do that? Or are you in social media, that sort of thing?
Well, I have a website that I'm still in process, but it's workable enough to where someone can email me at larrycfloyd.com. And so under the contact page that you can send me an email, I'll be happy to respond. That site will be a little more robust here, hopefully in another month or two. I've actually, after this book came out, I started working on another book, and it just went into print a few weeks ago, and so people are really all over me. You need to get a website up, and so you can and I'm all for that. So sometimes you don't have time when you're writing books. You can't work on your website. The book is available at Amazon, and the University of Oklahoma Press, who was the actual publisher of the book. And there are a few other places. I know a few of the bookstores in Little Rock are now handling the book, but Amazon is sort of the go-to for most people, and it's selling it on Amazon. I checked it right before we did this just to make sure.
Right.
And it'll go on for a while. Dr. Bates had hoped that it would actually be worked into the curriculum at the College of Public Health at the University of Arkansas Medical School. I'm not sure if he was able to get that going in time or not, but he thought there were enough lessons in there that it might be part of the required reading.
Okay, all right. Well, this has been a pleasure. So thank you for joining us today. If you're interested in reading Stalking the Great Killer, you can check it out from the library or purchase it from oupress.com or wherever books are sold. For more information, visit our website at nlrlibrary.org. Thank you for joining us today, and we'll see you again next time. And have a great day, everyone. And once again, thank you, Professor Floyd. This was a pleasure.
Thank you. It's been a pleasure for me too.
Okay. Goodbye.
Bye-bye.